Hi guys, I'm Tara. That's Mattie in the picture. This is Mattie in this picture. This is my first video without Mattie present. Welcome to my channel, Mattie Tails All. I wanted to, as I told you guys before, I'm going to continue with her channel, and with this first one being specifically about the cancer that she was diagnosed with, a terminal cancer. So I'm going to go into that, and also some of the treatment things that we're doing with our boy Oscar that is down here. Hopefully he'll come around at some point. I wasn't sure how to set up anything. I'm going to be talking about the different things that we're giving. He just had a mast cell tumor removed that was on his chest, his upper chest. It was rather large. Oh, there he is. Getting situated. But I'll show some pictures of his stuff too. I'll do a separate video in regards to Oscar and his cancer because as you can see, he is thriving since his surgery. Well, I guess you can't really see that he's thriving, but take my word for it at the moment. He is acting half his age. He is just recovering wonderfully from the surgery. We are believing and praying they got all of it removed. But like I said, at the same time, we are still giving him different supplements that will aid in the treatment of cancer. If there happens to be the most minute amount remaining, we're tackling it as best as we can. That is what we do around here. We research a lot, and I want to get right into it because I feel like I've been rambling a bit, and I really want people to stick around and listen to the whole video. So I hope that you do. If you're interested in learning more about specific cancers, then please keep watching. And so I'm going to take these off for a minute, and I wanted to talk about, so she was diagnosed with circumanal adenocarcinoma. It's a terminal cancer at the time. In doing research, permanent cure is seldom achieved with the malignant tumor anyways. But in her case, what the x-rays showed is that it had already metastasized and had gone through her lymph nodes, from her anus to her lymph nodes and her bladder, and like I said, metastasized. So we were looking at a few days instead of having time, to do surgery or the other treatments like chemotherapy and radiation that can be done when it has not metastasized. I want to take it back to when we were actually at the vet waiting to see the doctor, and Mattie was repeatedly squatting, and instead of pee it was just blood. And I'm gonna probably show some pictures just for people to see, like, get an idea of the different things, so warning on that. But it got worse and worse. Each time she peed, it would get darker and more blood. And the night before this vet appointment, I was outside with her thinking that she was peeing over and over and over again. But in fact, I feel like it was more of the same, that she was in fact bleeding each time that she was squatting outside that night before the vet appointment. And so taking it back even further, not much further though, it was about a week before that that she had been, well, we'll say 2 weeks before. We'll say about 2 weeks before that she had been collapsing every once in a while, like as she was going out to go to the bathroom or coming back in, or when she would come down from the couch that she would lay on. She had been collapsing. So we had initially, my mom switched an appointment that she had with her dog, and so that we could get in sooner and see what was going on. She had some other bumps that I was a little concerned about, but come to find out they were nowhere near the size of the one that was on her anus, but it's slightly to the right and underneath her tail. So I did not see this mass until we had already had the appointment scheduled, and it was about not even a week before. I was watching her drink water and I saw it. I had not seen it. And I can't stress enough how important it is to check your dogs for lumps, for bumps. Mattie was around us all the time, and she even slept in the bed with us. So you would think that we would have noticed this by petting her a lot, and just, you know, the visual detection is not enough. It's just not. So, like I said, the time frame in which these things happened was very quick, and all the way leading up to the fact that it had already metastasized and she only had days to live before this cancer was going to start putting her in even more pain. Because at the time she was eating and drinking and acting relatively normal for the most part, but she was panting at night when she was in the bed with us, and we just kind of thought, well, maybe she's just hot, like she's a bigger girl, maybe that's all it is she's just hot. It wasn't even occurring to us at the time that she was actually in pain. And it turns out that there was bruising really low on her, I guess you'd say stomach, but it was, yeah, towards her bladder more so, because she was straining to pee. And what this cancer does towards the end is it stops the animal from being able to have any bowel movements or use the bathroom in any fashion. And so then the bacteria takes over basically, and it can be very agonizing for the dog, which is one of the main reasons why we made the decision to let her go as peacefully as we possibly could. So in more detail about this specific type of cancer, it's a adenocarcinoma, which I guess I'm saying it right, of the sebaceous gland. And it's uncommon, even more rare in females. So the usual life expectancy with the surgery, that's if she were able to have it, which she was not, but it is, you would have surgery to remove the lymph nodes. That expectancy is 12 to 18 months, and that does include the treatment of chemotherapy and radiation. Okay, I don't know how to get Oscar in this video because the camera the lower I go with the camera, we're just gonna like chop my head off. But oh, there he is. Okay, so I want to talk about Oscar. There he is, just in the little teeny tiny corner. Yay! Thank you for your participation. Okay, so I am going to talk about the different things that we've been using with Oscar. The biggest thing that we've started the dogs on, Oscar and our dog Cammy, she has a small bump right now that we are watching. We're monitoring it. That's the most important thing, is that you monitor them in the beginning, because there can be lots of different kinds of bumps and lumps as they get older that are benign, thank God. There can be skin tags. There are lots of different ones. So I mean, I guess that's why we go to the vet. But to get back to what we have been doing and using to supplement the dogs to help along with the fact that we are not able to afford to give all of our dogs human grade food at this point in time, or a raw diet. We do use a kibble that has protein as the first ingredient, and we do watch the ingredients very closely because Cammy has urinary tract infections, so we do have to make sure that she does not have a certain 5 ingredients. But it's very important to follow up on a lot of different things that your animals have, and just everyday intake of food that can help them tremendously to not have like breakouts or whatever you want to call them. Side note, my husband and I have a dog rescue, Ocean Ray Rescue. We can talk about that more in my personal videos that I do, my vlogs, that hopefully I will pick those back up for Vlogmas. I really enjoy doing that. So the month of December, I will be doing a video every single day. We'll be trying to do a video every single day that's more personally focused. So if you'd like to tune into that. So back to what we're giving the 2 of them that's the most important right now is turkey tail mushroom, and let me just read a quick little thing. It boosts their immune system tremendously, is the main deal here. So it's the mushroom can address health challenges such as infections, immune deficiencies, and malignant cell growth. And I also watch videos by the natural pet doctor, Katie Woodley. I can reference her in the description box, but her videos, she has a lot of videos about food in general for your dogs, human grade food, different fruits and vegetables, different things to incorporate into their diet when you can't give them a full diet of that, like us. There are small things that you can do, such as blueberries and leafy greens, like 3 times a week. The percentage, I believe, is like over 80% fighting properties of different types of cancer. And through research, I have found that for different types of cancer, because turkey tail mushroom promotes the immune system, it's good, excuse me, for all of them. it is treatment for any type of cancer. And I say treatment, but it aids in boosting their immune system greatly, more so than other supplements. It's very highly regarded for this. So other things that we put in their diet on a regular basis is coconut oil and apple cider vinegar. Occasionally we'll add different things, like with our fosters, when they come in, we always add pumpkin so that they can clean out their system. It's a natural dewormer, along with banana, which is also a natural dewormer. Fibrous types of foods to help them just flush their system from being in the shelter, sickness, or on the street, same reason. So with the benefits, it's pretty common for people to use coconut oil and maybe apple cider vinegar, a little more common obviously than the specific turkey tail mushroom. But just to give you an idea on the things that are good, that benefit from the apple cider vinegar, and specific, it reduces itchy skin, it cleans itchy ears. There's a solution that you can make that we've also done for our dogs with ear infections, to flush out their ears. It improves dandruff. It acts as a safe and effective house cleaner. There's a human thing there. But it reduces the GI symptoms like gassiness and burping, and it reduces the reoccurrence of urinary tract infections. So we also give that to our dog Cammy for that reason, for that main reason. And so then going back to the coconut oil, it eases inflammation, it fights harmful fungus and bacteria. That's why we've used it with our dog Opal that has had fungus with her on her paws before. It happens a lot in white dogs. Yeah, they also get a redness, inflammation type of right there, that I was just previously talking about. It eases with coughing. Dogs that have kennel cough, they can use honey and coconut oil mixture for them to ease their throat during that time of them coughing and sneezing and all of that. It helps their coat, their skin, their fur, and it can help to eliminate odor. And now there isn't a nice list like this for the turkey tail, other than it basically focuses solely on the immune system, which is of great, like I said, significance. And we have given, also I didn't pull up the exact stuff for these other two, but with dogs that have allergies, because we have gone through that as well with Oscar. Once we figured out that it actually was allergies and not mange or scabies or a staph infection. I think there were 3 different things that they thought that he had before we, process of elimination and use of steroids, found out that it was in fact allergies. But what we have used to battle that, instead of the drugs that a vet has given us in the past, and when I do Oscar's story and his video in specific, where you'll be able to see him more, well, yeah, more. I'll go into all of that even more with pictures to show what we were dealing with back then. But we have given colostrum and quercetin to our dogs that have allergies or just need a natural boost in their immune system as well. That's the first immune boosting supplement that we had ever researched, and found that it has worked really well with our dogs. We've used that with foster dogs before as well, and most recently with our Hospice, which is a foster hospice dog. She's 13 years old, around there, and we have been using CBD oil, which I know a lot of people have in recent times researched CBD oil and given that to help their animals as well. We don't currently give that to any of our other dogs, but we do give it to her for her mobility, because she is having, we've seen the difference literally within about a few days of giving her the CBD on a consistent basis, which is only a few drops because she's small. But she's able to walk and she's not falling as much, and she's kind of running around and doing little hops like she was doing before. And within the last 2 nights we have seen her wag her tail, which we have not seen in a couple months. And so this has been like tremendous time for us with our hospice dog starting to make a turnaround. And our very first boy that we ever adopted together, made the decision on that. He is just doing great as well. I wish he was more a part of this video, and I'm so sorry if you are as much of a dog lover as us. I know you wish that he was in the video more, but I will wrap it up because basically I just wanted to get out this information if anybody was interested in canine cancer and the types that we have unfortunately had to deal with. And if we can give anybody information or help or advice, anything, we'd love to do that. That's the point. That is the point of this video. And if you have any questions, feel free to ask me down below. I'll do more videos about this. I think I referenced everybody that I've talked about, or everything that I've talked about. If not, I'll make sure that it is in the description. And until next time, I can't even sign off with a kiss because he's all the way over there. Oscar, come here. I'm gonna try this anyways. Come on. You guys might not be able to see. Come here. Come on. Oh, come here. Okay. Okay, there we go. Bye, guys.